It was 2:01 a.m. Ibrahim Traoré was examining a confidential file from the Ministry of Health. A loyal official had personally brought it. I couldn't trust anyone else, he said. The file was titled Protocol 25/7 Secret Clinical Trials African. Field its contents were horrifying. 5 Western pharmaceutical companies were testing drugs banned in Europe in Burkina Faso villages. Traoré trembled as he read the experiments targeted poor, uneducated areas. Side effects were concealed deaths unreported. Worst of all, the previous government had approved it. Traoré reached for his phone. Emergency meeting. Wake everyone up now. In the presidential palace's secret meeting room, 5 people gathered. Despite the late hour, Ibrahim Traoré, Health Minister; Dr. Fatima Konate, Intelligence Chief; Captain Musa, Attorney General Amadou Dio, and Health Ministry official Ahmed Urago. How did you find this file? Traoré asked. Wedrao, I gained access to a locked archive room. These files were marked destroyed but hidden in a secret compartment. Traoré pointed to the documents. These show that Global Farm, Metakitech Biosolutions, Pharma Plus, and EuroHealth have been conducting illegal clinical trials in our country. Dr. Konate examined them. These drugs are banned in Europe and America. They couldn't get approval for human testing there. Captain Musa pulled out a map. The experiments were conducted in 5 regions, 27 villages total, all remote places with limited education and healthcare access. Are there deaths? Asked Dio. 147 death reports categorized as unexpected reaction in the last 2 years, said Dr. Konate, but I suspect this number is much higher. There's evidence that causes of death were altered. How were people convinced? Asked Traoré. They were approached with promises of free health screenings and modern treatment, said Urago. Most didn't know what they were signing, and they were paid $25 per month. Added Musa, not a small amount for our people. Traoré walked to the window. The city of Ouagadougou slept in darkness. His people were being used as guinea pigs on their own soil. These companies must answer, he said calmly but firmly. The whole world must see what has been done. But Mr. President, said Dr. Konate, these are the world's largest pharmaceutical manufacturers. They have powerful backers. Are you suggesting we should be afraid? Asked Traoré. In his eyes, should we remain silent while our children are used as lab rats? Dr. Kennett bowed her head. No, Mr. President, we just need to be prepared. Then we will prepare, said Traoré, but first we need complete, undeniable evidence. Captain Musa straightened. I have 2 special operations teams. With your permission, they can visit these villages, talk to witnesses, and gather more evidence. We must do this quietly, said Traoré. If the companies suspect anything, they might destroy evidence. What about the ministry leak? Asked Dio. Someone must be feeding information to these companies. Only the 5 people in this room will know about this operation, said Traoré. He turned to Ouedraogo. Return to the ministry and act normal. I'll assign protection for you. The meeting ended with a plan. Captain Musa's teams would investigate the villages. Dr. Kanita would examine hospital records. Dio would investigate the previous government's approvals. Ibrahim Traoré had taken the most dangerous task to meet with the company executives at the West African Health Summit. 2 days later, at the Azalai Hotel, Traoré delivered the opening speech of the summit. In the front rows sat the African directors of the pharmaceutical giants. Thank you for your interest in Africa's health problems, said Traoré diplomatically. Without companies like yours, our people's access to modern medicine would be much more difficult. The executive smiled, unaware of the anger boiling inside him. After the speech, Global Farms Africa Director Dr. Richard Barnes approached Traoré. Great speech, Mr. President. Our company wants to expand our health programs in Burkina Faso. Perhaps we could arrange a meeting. Traoré smiled, hiding his disgust. Of course, Dr. Barnes, tomorrow morning in my office. Meanwhile, Captain Musa's team reached the Kongusi region. They introduced themselves as health researchers. Village Chief Abubakar welcomed them. Health research? Yes, white doctors come every month. What kind of research? Asked the team leader secretly. Recording. They give us pills. We take them. They pay us. Some get sick, but usually recover. Were there any deaths? Abubakar hesitated, eyes filling with Tears, 5 children died last year. The doctors said it was malaria, not the pills, but none of the children had malaria symptoms. The team spent 3 days investigating. They discovered people had been divided into experimental groups. Some received placebos, others low or high. Drug doses, side effects were recorded, but not treated in Ouagadougou. Dr. Kanite examined hospital archives. She found inconsistencies in patients' files from the experimental villages. These patients came from the same village, admitted the same day with similar symptoms, she told her assistant, but their official diagnosis are completely different. These records were manipulated. Attorney General Dio found that the previous health minister had received millions in Swiss bank accounts for approving the experiments. That evening, the team reconvened. The evidence painted a horrific picture of Western companies testing banned drugs on poor, uninformed communities. The next morning, Dr. Barnes arrived at the presidential palace, confident and smiling. "Thank you for considering our company's expansion in Burkina Faso." Traoré didn't rise from his desk. "Sit down, Dr. Barnes. We have much to discuss." Barnes pulled out glossy brochures. "I want to tell you about our new HIV prevention program, specially developed for Africa. Let's talk about protocol." 95-7. Traoré interrupted. Barnes froze. "Excuse me, the clinical trials you're conducting in Kongusi, experimental drugs with liver failure side effects." Barnes's face turned white. "I'm not informed about this. Probably a misunderstanding." Traoré pressed a button. The room darkened and images appeared on screen. Photographs from villages, drug packages, patient records. "This is evidence that your company and 4 others are testing banned drugs on my people." Barnes jumped up. "I reject these accusations. Our company follows the highest ethical standards." "Sit down." "I'm not finished." Captain Musa entered with a thick file of evidence. Witness statements, original patient records, laboratory analyses of drug samples. "Tell me," said Traoré, "how much was paid for this operation? How many lives were calculated as acceptable losses?" Barnes was sweating. "Mr. President, I'm just following orders. These decisions are made at higher levels following orders." Traoré repeated sarcastically. "How many times has this phrase justified history's darkest crimes?" Barnes stood. "He should continue this with my lawyers." "No, Dr. Barnes, you'll continue at the International Criminal Court. We have sufficient evidence of your crime." At that moment, the directors of the other 4 companies were being detained in the waiting room. "How much did you pay to use my people as guinea pigs?" Traoré asked. "How much money equals how many human lives for you?" 2 days later, Ibrahim Traoré held an international press conference. CNN, BBC, Al Jazeera, and other networks broadcast live. "Today, I share with you a horrific human rights violation in my country and probably other African countries." Traoré began. The presentation showed photographs from villages, records, drug analyses, patient stories. Global Farm MedTech, Biosolutions, Pharma Plus, and EuroHealth have tested banned drugs on uninformed people in remote villages. During these tests, at least 237 deaths occurred. Traoré detailed each company's activities. The hall listened in shocked silence. "These companies paid our people $25 monthly to use them as guinea pigs. Most couldn't read what they signed. However, the crime extends beyond these companies. Our previous government took bribes. Some WHO officials knew but remained silent. Western countries turned a blind eye." A Western journalist spoke up. "Mr. President, these accusations are very serious. Perhaps what Traoré cut in, perhaps I'm mistaken. We're making all evidence public. We invite international investigation. We're not afraid of the truth, but are you as the press?" Conference continued. People worldwide watch Traoré systematically expose the abuse. "Today, I'm only exposing 5 companies in Burkina Faso, but how many more African countries are affected? How many more innocent people are subjected to dangerous experiments?" Traoré announced. "All clinical trials in Burkina Faso are stopped. All pharmaceutical licenses are suspended. Those responsible will face justice. We request investigations from the UN and the International Criminal Court. We expect cooperation from these companies' countries of origin." In his boldest move, Traoré announced the confiscation of all drug stocks and equipment of the 5 companies. These will be used for treating patients. Frozen accounts will compensate victims. Western pharmaceutical companies quickly responded. Global Farm issued a statement rejecting the accusations and threatening legal action. Western governments defended their companies. The U.S. State Department expressed concern about violation of American companies' treatment rights abroad. However, worldwide protests began in major cities. People gathered at pharmaceutical headquarters. Social media hashtags, #Burkina, truth #, drug experiments and #Africa is not a guinea pig trended globally. The most unexpected support came from within the companies. A global farm scientist revealed, "We knew about these experiments. Management told us deaths in Africa were an acceptable risk." A week later, the World Health Organization called an emergency meeting. Traoré presented his evidence to world leaders and health officials. "This isn't just Burkina Faso's problem," he said. "It's about human dignity, global justice, and medical ethics." When will Western companies stop seeing Africans as guinea pigs? At the meeting's end, a historic decision was made. An independent audit mechanism would be established across Africa with African experts overseeing all clinical trials. "This is a good start," said Traoré, "but not enough. We also want justice for the victims." The WHO president resigned. The 5 companies agreed to billions in compensation, but Traoré wanted more. "Money cannot bring back lives," he told the press. "We want structural change. We want Africa to build its own pharmaceutical industry, conduct its own research, protect its own people." Traoré's handling of the crisis mobilized all of Africa. Other leaders initiated investigations. Similar experiments were found in Nigeria, Ghana, Kenya, and Uganda. A month later, Traoré spoke at the UN General Assembly to a silent hall. "You say you help us, but you use us. You say you bring medicine, but you make us lab rats. You lecture us about humanity, but violate our basic human rights. Africa is waking up. Africa will no longer remain silent." His speech received a standing ovation from African delegates. 6 months later, a health center opened in Kongusi village with modern equipment. Trained doctors and a system villagers could trust. "This center is dedicated to our suffering brothers and sisters," said Traoré at the opening here. "Our own doctors will serve with our own medicines." The scandal had an unexpected outcome. International pressure and compensation helped Burkina Faso establish its own pharmaceutical industry. The African Union launched a continent-wide drug research program. Village chief Abubakar shook Traoré's hand. "Thanks to you, we're no longer afraid for our children. We trust medicines from our own country, not the white man's pills." Inside the health center was a laboratory connected to one of Africa's first pharmaceutical production facilities. African scientists who had received Western education but returned home worked here. Dr. Amara Diallo, formerly of Global Farm, led the team. "We're combining traditional African medicine with modern science," she told Tracy. "We've developed a new malaria drug from local plants." Traoré watched the young scientists with pride. "These people are our true wealth, more valuable than gold or oil. Their intelligence will build our future." The establishment of the African Medical Association and continent-wide pharmaceutical production brought economic revival. African countries now kept billions previously spent on imported drugs. A year later, at the World Health Summit in Geneva, Traoré was welcomed as a hero. Pharmaceutical executives lined up to partner with him. "The conditions have changed," Traoré told Global Farm's new CEO. "If you want to produce drugs in Africa, 51% of shares remain in Africa. All research must be transparent. All trials supervised by the East African Medical Association." After the meeting, the WHO's new Ethiopian President Dr. Makdis told Traoré, "The movement you've started is changing not just Africa but the whole world. Latin American and Southeast Asian countries are making similar demands." Traoré smiled. "This is just the beginning. Our goal is for all developing countries to control their own health systems." At the first anniversary of the Kongusi Health Center, villagers welcomed TR with drums and dances. Abubakar gave him a wooden statue. "The protector of our village, may it protect you as you have protected us." A young mother approached with her baby. "I named him Ibrahim after you. When he grows up, I want him to protect his people like you Traoré. Took the baby in his arms, this child. Will grow up in an Africa that writes its own destiny not as a guinea pig, but as an explorer, not as a victim, but as a leader. As the sun set, people danced. Around a fire tray joined them dancing. Now with his people, this is real. Independence, he thought, protecting your people, producing your own solutions. The change in Africa spread to other continents. The Convey protocol set ethical standards for clinical trials. Globally, Traoré became a global figure, chosen as Times Person of the Year and nominated for the Nobel Peace Prize at the opening of the African Medical Research Center, the world's leading. Scientists gathered. Traoré spoke this. Story began with anger, with rebellion. But now it has turned into healing, into renewal. When we confronted humanity's darkest sides, we also discovered its brightest: solidarity, justice, and dignity. 5 years later, Convey had become a regional center. The health center had grown, educational facilities added, agricultural projects developed. Abubakar, now very old, hosted Traoré. Our elders said, when an evil is done, you either take revenge or bring healing. You brought healing instead of revenge. Traoré bowed his head. The real heroes are you, those who suffered silently, then had the courage to tell the truth. Outside, healthy children played. They were no longer guinea pigs, but architects of their own future. Traoré saw the true result of his struggle, not just exposing a scandal, but restoring a continent's dignity. Years later, Ibrahim Traoré sat in his office looking at the Protocol 95-7 file that had started. Everything he thought about how that night had turned into a global movement. Western pharmaceutical companies now worked as equal partners in Africa. Research was transparent, profits shared fairly. He looked at his country's horizon. Burkina Faso had become Africa's drug and health center. A message came on his phone: African-produced drugs now met 70% of the continent's needs, up from 10% 5 years ago. This thought tray is real. Independence measured not by flags and anthems, but by the power to protect your people. When Ibrahim Traoré eventually retired, he settled in a remote village as a simple farmer, but his story continued to be told throughout Africa. In schools, the drug revolution was taught as a turning point in Africa's journey to self-sufficiency. His old office became the headquarters of the African Health Organization. March 15th, the night the file reached him, became African Medical Independence Day. Sitting in the shade of his garden's baobab tree, Traoré thought, isn't true leadership turning crises into opportunities, creating healing from pain, justice from anger? Perhaps this is a nation's true independence, finding the strength to heal its own wounds. With this thought, he gathered vegetables for dinner. No longer a president, just an ordinary person who had won an honorable battle. Ibrahim Traoré discovered the secret in the health ministry.